with straight talk about COVID-19 and the latest information from the leaders in Thunder Bay and across the country. Exclusively on Mornings in the Bay with John Ongaro. Only on 99.9 The Bay.
8:13. And away we go. Week 3 now underway. A nice start to the morning. We'll go up to around 8 or so today. It is -2 right now at the corner of Park and Water. With so many guests on this program over the last couple of weeks, it was time to maybe bring in an expert, a physician, because there are a lot of questions and a lot of people that are kind of wondering what to do next and probably could use the help of a physician at this point. So this morning on the program, Dr. Danielle Harris from the Harborview Family Health Team. Good morning, Danielle.
Good morning, John. Thanks for having me.
No problem. Listen, this is a crazy time, and as a physician and a family physician that you are, this must be getting a little stressful for the patients that you have already.
You know what, John? Yeah, some people in the community are understandably concerned or apprehensive because this is new ground for all of us. But the fact that we've had our new first cases, it's really just inevitable. It was just a matter of time, especially with the ease of travel and the spread. But overall, I think the cases have been dealt with quite appropriately. Our medical teams at the regional have been diligently preparing for the arrival of COVID. And with our isolation kind of relative to Southern Ontario, it really has afforded us just that little bit of extra preparation time that some other communities may not have had the luxury of. So there's been like a multitude of meetings on a near daily basis where all medical practitioners are virtually gathering to create these pandemic plans and responses. So whether that's in the hospital, the clinic, the community, and overall, I just want to reassure people that, you know, our community is in extremely good hands. We're very fortunate to be under the very wise leadership and guidance during this outbreak with some brilliant physicians like Dr. Zaki Ahmed, who is our lead ICU physician and chief of staff at the hospital, and Dr. Stuart Kennedy, who's actually a very valued member at our family physician clinic and the lead COVID response coordinator. So just reassuring, we're in good hands.
Now, as a family physician, you're still open and you're still seeing patients, but the patients that are coming to you, are they expressing more worry about this? Because obviously they're coming to you for other things, but this must come up in most of your conversations.
Absolutely. Sure. People do have a lot of questions, and sometimes it can be really difficult at this time to give them the answers that they want. Like, how long is this going to last? How long do I have to do this for? And unfortunately, we don't have all those concrete answers that people want. We'd like to know those answers too, but all we can do is really ride this out together.
Now, the patients that are coming to see you could be a bit of a help too. For those of us that, and we briefly talked about this over the weekend, for those of us that, you know, we're due to go see a family physician or our family physicians that may or may not be in a clinic that's open, things like renewing prescriptions or just regular checkups. Should we be holding back on those things, or what can patients be doing to help you guys out in the clinics?
Absolutely. So couple things there. So what can patients do to help? That's a really great question. It's still too soon to see how much our interventions have really flattened or quote-unquote bent the curve. But people need to continue using those current strategies from the Ministry of Health, and just remember and not to get discouraged that what we see today is the effect of about 2 weeks ago. So people have to realize they are helping by staying home, physically isolating themselves from friends and non-nuclear family members, and not visiting your loved ones in retirement homes. I mean, don't hoard food or cleaning products or toiletries. Take the time to check on your elderly neighbors with a call or lend them a hand by getting groceries or dropping off supplies. When it comes to our family medicine clinics, over the past few weeks, we've been making some quite significant changes to really minimize patient traffic through the office to hopefully prevent possible transmission. So rather than routine in-person appointments, we've changed more to phone call or virtual appointments, but this is really only for urgent patient needs. So we're canceling or rescheduling appointments for future dates that are not deemed urgent, but our services are still available. We are still there to do prescription refills via fax. We're trying not to hoard medications as well, because In case there's any shortages at the pharmacy, we want to make sure that everybody's getting a fair amount as we're going forward. But yeah, this is still an evolving learning curve for all of us. So we just ask patients to please be patient and be understanding as this information changes rapidly with new evidence arising on a daily basis. But when it comes to family medicine, I have to emphasize, please do not come to the clinic if you have symptoms or suspicions of COVID, because we do not have the appropriate negative pressure rooms, the swabs that you need for testing, or even the right PPE to prevent contamination of our staff or office. So, yeah, call telehealth or the health unit.
That's an important note, is that going to your family doctor to get checked out for something like this is not something we need to be doing. And it sounds like most clinics are taking the right steps to make sure that there's not high traffic in those places. But as a family physician and working with family physicians of all different experience levels, you guys are really learning this on the fly just like everybody else is, aren't you?
We sure are. And so that's kind of why we're having these very large assortment of meetings, so that you get people from different experience levels. So whether that's consulting with our infectious disease or internal medicine team, or whether that's dealing with people who have worked through SARS, I think that the hospital has really great progress since experiencing SARS, so that they do have all those protocols and things in place so that they know generally what the guidelines should be, and they can inform us family physicians what we can then do at a community level as well.
All right. Speaking of those guidelines, on Friday we had Minister of Health Patty Hajdu on the program, who is still incredibly frustrated that groups of people are still hanging out and that people are not social distancing or physical distancing as they should. The country has some really strong health advice to prevent all of this. And this is advice that I'm sure as a physician you're giving your patients all the time too, right?
Yes, absolutely. Absolutely. So just to recap, for anybody who may not have turned the TV on or, read a newspaper in the last month, to recap, wash your hands, soap and water, 20 seconds. So you want a nice froth. You want to sing happy birthday twice to yourself or whatever 20-second song you'd like to sing. And there's even paint videos online where someone wears gloves and pours paint in their hands to show how you really do need to cover all of your hand when washing it. The other thing, stay 6 feet or 2 meters apart at all times. That way your fomites, your respiratory particles aren't being transmitted to other people. Don't touch your face, cough into your sleeve. But the most important thing is stay at home. Physically distance yourself. So we're learning it's not a virus that just affects the older population. We're seeing more and more cases in the younger demographics now being affected too. And even if you feel completely well and you're currently asymptomatic, you have to realize this virus can be transmitted through community spread even before we display symptoms. And they're showing in Canada now that more than 50 to 65% of the cases are being transmitted this way. It may not be the case yet in Thunder Bay, but for the people of Thunder Bay, we should only be leaving the house for absolutely essential items on a very limited basis. There should only be one designated person to leave if needed. And to clarify, it's not okay to socialize in small groups, even if you feel well. You should only be associating with those who live in the same house as you. So not your friends, your extended family, play dates, non-essential shopping. That's it. Stick to your tiny group of household people. And when it comes to travel advisory, there's two different kinds. So what you have to remember now by law is if you've returned from out of country, you must quarantine yourself for 14 days. This is law. So if you don't follow it, there's penalties, there's jail time, there's significant fines. And so what that means when you have a travel-related or symptom-related quarantine, so even if you don't have yet a positive COVID test, you have suspected COVID or just mild symptoms, what that means is you have to stay inside. Do not go outside. That's no shopping, no gas, no coffee. Don't socialize with family or friends. Don't even go for a walk. You have to stay inside. If you are physical distancing, which is what all of us should be doing who aren't affected or haven't traveled or have no symptoms. What that means is you can still go for those essential errands if you absolutely have to. You can take your dog outside for a walk or walk with your significant other, but you have to keep that safe distance from other people and only go again with those people who are in the same household as you. And as of today, or at least the weekend, Ontario is now limiting groups to 5 people or less. And as of today, March 30th, they're trying to strongly advocate and recommend that even if you travel outside of Northwestern Ontario, you really should be quarantining yourself, total isolation inside for 14 days to prevent spread to Thunder Bay as well.
It's seems to be a little bit of a trend of people getting together in driveways and parking lots and those kinds of gatherings. Now with this new law in place about 5 or less, I'm hearing from what you just said, the advice of even just getting together and physical distancing from one another outside in a large space is still a bad idea. And
those videos are certainly great to watch because you could just see how social of creatures we really are. And I know that this is really hard for people, and especially with some holidays coming up for some people like Easter, it's going to be challenging. But there are other ways to stay connected that don't expose us potentially. So, I mean, we're lucky in this time and age that we have those technologies to stay connected, like FaceTime or Skype or Zoom. And, you know, the media has now changed the term social distancing to be physical distancing because we understand that the situation can have a negative impact on our mental health. But I urge people to try to reframe the situation in your mind. So instead of feeling trapped inside, use this opportunity to spend quality time creating memories with your kids or play with your pet, learn a new skill, or, you know, we could finally tackle that never-ending to-do list that we all have, that you now have some time to address.
Listen, you're a family doctor. You have a practice, a job to go to, but you also have a family, and you're a resident of the city like everybody else. Take off the doctor hat for a second. How concerned are you?
I mean, we're all in this together, and there's only so much that we can do. Worrying is not going to make it any better. I always say to my patients, worry when you need to worry, and don't worry when you don't have to worry, because then you lose those potential moments of happiness.
Right.
So, I mean, do what you can because it is making a difference. Don't get discouraged. And again, we're all in this together. So we're going to tackle this as Thunder Bay.
That's solid advice. And as a physician, you recognize that there are mental health concerns with this. There's a lot of people that are feeling very stuck and very lonely and are in apartments or are aging and in apartments and are not having those visitors. It's really about keeping yourself busy and still being connected using technology or just even picking up the phone.
Absolutely. Absolutely. I think that's super important. And again, we can all do our part by checking on whether that's your grandma, your grandpa, your elderly neighbor, your single uncle or aunt, and just connecting with them. Take that opportunity and say, you know, I haven't heard from you. How are you doing? I've even seen some people, you know, on videos talking through glass windows or having signs or playing music. There's a whole variety of creativity that's coming out.
Well, we are in this together, so we got to keep at it. Danielle, thank you for this time. I know you're busy and you've got a practice to run, but we appreciate your insight. It's a different way of looking at things, and so if you don't mind, we're going to call on you again because this is an important conversation to have, and we know that all of this is going to change probably daily or at least weekly. So let's touch base again.
Absolutely. Sounds great, John. You have a great day.
Thank you so much.
All right. Bye-bye.
827, Dr. Danielle Harris from the Harborview Family Health Team. That's what it's all about. That's why we ask the experts. Some solid advice in there. Stay home. Just stay home. That's all you need to do. We'll get through this. News is next. Jackson Brown now is on 99.9 The Bay.
Looking out at the road, wishing